There's also announcing 8 new deaths. They say all patients had underlying health conditions. Active cases are close to 22,000 and the recovery rate is now down to 60%. All new tonight, the El Paso Public Health Director, Angela Mora, tells KTSM due to issues with the state uploading new cases, today's numbers were a combination of today and Tuesday's numbers. KTSM 9 News reporter Stephanie Shields is in the newsroom with a breakdown.
In a statement, Mora says Wednesday's actual number should have been 1,537, not 3,100 due to a late upload Tuesday evening. Either way, she says cases are on the upward trend, and local doctors say delayed cases are not, hospitalizations are rising.
The community really has to sort of take a step back and figure out where we're going.
Dr. Ogachika Alozi, Chief Medical Officer at Del Sol Medical Center, urges the community to take serious precautions as the virus spreads like wildfire in just a matter of days.
The community has to sort of look inside themselves and say, this is not the Thanksgiving to have 20 people over. This is not the Christmas to have 30, 40 people around the tree.
In a statement sent to KTSM, the Office of Emergency Management reads in part, quote, "It is estimated that about 1 out of 5 people testing positive will need hospitalization, and that number is a lot higher when considering age, pre-existing, and medical conditions."
All of the hospitals are at a point where with FEMA resources, DOD resources, and our teams being stretched where people are tired.
City leaders and health experts continue telling the community to stay home.
That socialness is what's killing us. When we have a positivity rate of 22% and we're testing as many as we are, we're probably only picking up 1 in 5 positives. And so today, 3,000, potentially 15,000.
As of Wednesday, with nearly 22,000 active cases, meaning those infected can still transmit the virus, the city said it would start reporting a zip code map of active cases rather than a collective total.
People need to understand that we have a raging epidemic. It's potentially out of control. And as a community, we need to come together to control this.
The public health director says the department is adding about 80 more contact traces to help the management of about 4,000 cases daily. In the newsroom, Stephanie Shields, KTSM.